Thanks for tuning in to this YouTube video about appreciative inquiry and how it can be used as a research technique to make public services more responsive to complex needs of individual citizens. My name is Charlie Dorr and I'm a researcher in residence on the Plymouth Health Determinants Research Collaboration, or PHDRC for short, a research programme which aims to use evidence to tackle the determinants of health inequalities in Plymouth. I'm joined here by Gary Wallace from Plymouth City Council, who is manager of the Plymouth HDRC. While I'm a relative novice in appreciative inquiry, Gary has been championing the approach for years, working with partners both in Plymouth and across the whole UK to utilise it as a method to improve public services. Gary is personally undertaking appreciative inquiry on a range of different topics, from the use of recreational spaces to smoking cessation, and has also taught his approach to public service professionals and community activists. For this video, I'll be asking Gary some questions about why and how he's used appreciative inquiry, how his approach might differ from others, and how other public service practitioners, community representatives, and researchers can make use of it. And Gary also has a few questions for me. Before we begin, I should clarify one thing. When we talk about appreciative inquiry, here we are spelling inquiry with an E, not an I. So appreciative inquiry with an I was developed as a research approach by David Copperrider in the 1980s and has become a very popular tool for stimulating positive organisational change. Gary's approach is linked to this, but has some noticeable differences, which is why the E is preferred. Hey Gary, sorry for the two-part question, but I'd first like to ask you what you mean by appreciative inquiry with an E, and secondly, how it differs from more conventional appreciative inquiry with an I.
Well, it's kind of a dictionary thing. So in English, we have inquiry with an I, which is a formal inquiry, and inquiry with an E, which is an informal inquiry. And if you're trying to get very busy professionals to do stuff, it's better to go down the informal than the kind of formal route. The thing about appreciative inquiry, it's very easy to teach people. But the other kind of key difference is a traditional appreciative inquiry with an I, like you say, is kind of developed from organisational change. It's about focusing on positives. I didn't want to just focus on positives. I wanted to have a really kind of open conversation because we're using it in change processes, and we're interested in understanding the kind of whole breadth of a person's lived experience in a system, and that some of that will be negative, some of that will be positive. So we ask really open questions to give people the maximum opportunity to tell us what's important to them. Yeah, so that's one.
And so that's really interesting. One of the criticisms of appreciative inquiry is that it focuses on the positives, potentially to the exclusion of negative experiences, which especially service users may have of services. And when I've asked you about appreciative inquiry before, I know you've mentioned the point about raising dissonance and surfacing dissonance, which almost seems to contradict how appreciative inquiry with an I is used. It's very much around this is very positive. We want people to feel positive about this service, even if we're going to improve it. So maybe if you could unpack what you mean by unsurfacing dissonance a bit more.
Yeah. So I used to, many years ago when I worked in services in helping people change that with that addiction, mental health, offending, whatever it was. There's no change without dissonance. So that at the level of the individual, cognitive dissonance, this kind of internal dialogue is what's necessary for that person to exercise agency. And similarly, if you're trying to change services and systems, it's important to surface the dissonance is already there. Is to surface that, and actually in surfacing the existing dissonance, you often produce more dissonance, and kind of dissonance is the currency for change. And so that's why I'm always interested in helping people engage with dissonance. I don't see that as a negative thing. Most public servants want to do good in the world, and when they see the dissonance in the system, they're really anxious to try and resolve that. And and that's kind of our impetus to change. Yeah, so that's kind of why I talk about surfacing, producing, engaging with dissonance. It's necessary but not sufficient, but it's a necessary element to any change process.
And you mentioned why, you've explained very well how, why you use inquiry with an E rather than inquiry with an I. I suppose the next obvious question is, what do you think, why is the term appreciative still important in terms of your appreciative inquiry?
Because it's about, there are often narratives about broken public services. My kind of experience is there are lots of things in the way we organise services that are really frustrating for everybody. They're frustrating for the commissioners, people delivering services and the people using services. But one of the narratives you sometimes see is denigrating public sector workers. And my experience of public sector workers is they're brilliant people, very poorly paid very often, and they want to do good things in the world, and they're kind of very frustrated. So I want to make it clear that that I appreciate what they do. My kind of fundamental belief is if I can show people things that moved me, they will also be moved. But the other thing, if you're doing whole systems change, you want to create this sense of shared endeavour. And one of the ways you do that is by involving everybody in the work. But it's also about creating these relationships of empathy and trust. So it's important to me to be clear that I do appreciate the work people do. I also appreciate they're very frustrated. You know, it's that thing that I'm sure you found yourself. Very often, people are doing these, they're bending rules in order to do the right thing. And a lot of change work is about kind of acknowledging that this is a person in the face of all these structural barriers that prevent them from doing the right thing. They are still trying to do the right thing. So for me, it's important to kind of linguistically appreciate them, kind of practically appreciate them for the work they do and the things they try.
And that, I guess, also comes back to criticisms you've made of conventional sort of approaches to public service delivery, particularly sort of new public management, which not everybody watching will be familiar with, but maybe you could sort of outline those.
So this is kind of operating model we've had in most of the developed nations for at least 30, 40 years. And it's often called the 3 M's. So the idea that markets are efficient because we have to protect public money, that we need metrics in order to make sure the money is being correctly spent on, in inverted commas, results. And if you're going to do those two things, you need to create a whole class of workers to manage that. So it's markets, managers, and metrics. And as you will know, and others will know from the research, almost all the planks of new public management are not true. There's a ton of research saying actually it makes everything worse rather than better. So if you look at markets, if you think about the NHS, it's not actually a market. When Mrs. Thatcher introduced it, she explicitly said it's not a market, it's a simulation. And really even a cursory study. So in a proper market with multiple buyers, rather than a monopoly where you've only got one buyer, in a proper market with lots of buyers and lots of providers, rising demand is a great thing because you can either recapitalise your business or you can increase your prices. Well, that's, in the NHS, rising demand is a terrible thing. Everybody hates rising demand. So there are loads of even you don't really even have to understand economic theory. It's nonsensical. So there's no kind of incentive for let's say a monopoly provider of hospitality placements for children. There's no incentive for them to build more places because they'll have to lower their prices. So the market thing doesn't work. And also it's really, really expensive. So you need all these commissioners to do the market management. And then within the acute, we're not very far from the acute trust, the hospital. They have legions of managers, and their role is to make sure we hit these targets, which brings us on, or the metrics, which brings us on to the next kind of problem, which is we measure the things we can measure, not the things that are important to people. These are called quantitative proxy targets. They're often kind of numerically based targets. And they often bear no relation to people's
selected for the ease of measuring them rather because they represent something substantive, substantial improvements to people's lives.
Yes. So if I can, I'll give you two examples. So there's a metric in substance misuse services called successful completion, which is I think the definition is discharged not on methadone and did not return within 6 months. I did an appreciative inquiry on a successful completion. Who was sleeping in a doorway, injecting into his neck 4 times a day. Similarly, if you think about smoking cessation, the metric is 4-week quit. So you quit for 4 weeks. And any smoker will tell you that's not a real quit. You need a much more sustained period of time.
And any research would look at least for 6 months.
Absolutely, yeah, absolutely. Now, what that means in practice, and there's no kind of sense of blame with this, is just how people kind of run their public management systems. If you go to a smoking cessation for the 4 weeks, you'll get a brilliant service. You get lots of motivational interviewing, you get scented sex. You get lots of appointments, lots of encouragement, lots of opportunities to try things. As soon as you reach the 4-week quit, you're discharged. So kind of at the point you need maximum support to make your gain sustainable, it's taken away because the other impact of metrics and markets is everything becomes transactional and packaged. So 6 of this or 8 of that or 4 of that. There's almost no customization. Lots of services will say they do individualized care, but when you look, they really don't. And that is all driven by this kind of really transactional thing. In the last decade or so, particularly with the rise of digital services, we've got more and more and more transactional. And if you look at the pinch points in all of our systems, they're in unplanned care. So things like out-of-county placements for children, expensive placements for people with mental illness, the crisis in emergency departments. And they are largely driven by groups of people with chronic conditions. There is no cure. And what we did 10 or 15 years ago after the credit crunch, lots of our really kind of low-level support services were cut because they were seen to be not curing people. What we understand now is what they were doing is keeping their heads above water. And when you take them away, those people don't disappear. They phone an ambulance. You know, they go to the ED, they use the GP, they use unplanned care, and it's much more expensive. Appreciative inquiry is a way of now kind of everyone who works in the system kind of understands that. It's a kind of, it's a kind of hidden thing. The other thing I should say is new public management creates relationships of dishonesty. So there's a very big systematic review that Franco Santos and in 2019, theorising the unintended consequences of performance management systems. 80% of studies of new public management find evidence of gaming, and 74% find evidence of deliberate lying. Now, the gaming thing, there are kind of a number of techniques that people can use. Creaming and parking is a really kind of common one. So you only take people into your service if they are likely to become a successful completion or a 4-week quit, which means the people that need our services most are the least likely to get it. And they tend to end up in your direct access hospital or your street level service or rough sleeping, which is a kind of crazy place to be in. And services also have become highly thresholded. And for many of our people, that kind of militates against prevention. So often, you come to my service and I say, effectively, the message I give you is, Charlie, you're not sick enough. Come back when you're very much sick, rather than I could do something to stop Charlie becoming sick.
Which in the long run is better than me, actually better.
Better for the public purse.
So going back to appreciative inquiry, and what sort of made you start to look at appreciative inquiry as being a method of research and inquiring into how to make system change?
So when I first started to do systems work, which was actually when I was in the NHS before public health transferred to councils, I would say to public-facing workers, I'd like you to have a really open conversation with your patients, clients, whatever you call them, and they would say, "Well, we already do them." And but when we were setting up the Plymouth Alliance for Complex Needs, I and a number of others had sat in on lots and lots of one-to-one appointments, so kind of behind the counselling door to see what happened. And we noticed two things. They're generally very good quality. Three things. They're often very similar. So an addiction conversation might start with a methadone dose, and then it's a really good quality health and social care conversation. A housing thing would maybe start with rent arrears, and then it would be a similarly very good conversation. But what we also noticed is people do tell you their life story in a sense, but the listener is doing pattern recognition. So, I'm telling you all about my life, and what you are listening to are cues that will help you decide, have I met your threshold? If I have met your threshold, which off-the-shelf packages of care am I likely to need? And so I started to say, are you interested in learning this technique for listening, for deep listening, open listening, whatever was kind of sexy for them? I could use that to try and sell it. Workers like to get new skills, and I was giving it away free. So really, that's why I settled on appreciative, on my version of appreciative inquiry, was to take people out of this frame where they imagine they listen, and they kind of listen in a very different way. And we've got loads of experience now of how just putting someone in a frame, but we're doing an open listening project, fundamentally changes the way they listen and what they hear, and the interpretation of what they put on what they hear. So that's why I started to use that. And the other thing, when you introduce this to services, 99% of the time, I just make that percentage up, but it's a very high percentage. Services will say, we'd like to ask them how to improve our service. And I always say, well, we might ask that sometime in the future, but to begin with, we're not going to ask that, because it assumes the central position in people's lives as services. And actually, if you ask them things like, tell us about your family, tell us about a helper who is important to you, tell us about your perfect day, your typical day, your worst day, they very rarely mention services. They mention all the things we would mention, their families, how they want opportunity for their children, how they are struggling with money, so they'll tell you a range of strengths and a range of challenges that they have, none of which directly relate to services, but all of which help humanize that person to the inquirer. So very often workers are taught to maintain professional distance, all that kind of stuff. And that's a kind of form of othering, amongst other things. When you have an appreciative inquiry type conversation, you are confronted with how similar human beings are to each other, rather than the very small things that divide them.
And you're looking at it from their perspective rather than from the perspective of the service.
Yes.
And this goes into the sort of another abbreviation of human learning systems, which you've been obviously working on a lot with other colleagues and council practitioners and academics across the country. So that's really interesting. So going into the sort of practicalities, how would you normally start an appreciative inquiry sort of process? If you could sort of maybe outline some of the key steps.
Yeah. So the first thing I want to say is we don't exclusively use appreciative inquiry. Sometimes appreciative inquiry is the starting point. Very often data is the starting point. So if I think about the smoking cessation, the no strings vape offer that I did with Dan, what drove that was the data around the people that were going to make a station, which was not very many poor people. It was mainly middle class people. And similarly, when we looked at the data around the children with a diagnosis of morbid obesity, they couldn't attract them, they couldn't retain them into the tier 2 weight management service. So there's very often what as we were at the time commissioners, what sparks your interest is the service data, and you think, oh, we've kind of drifted away from the purpose of this service, and we need to do something differently. And then you might say, we're gonna do some listening. Who wants to be involved? We're going to teach you Appreciative Inquiry. You can teach it in 2 or 3 hours, but also there's something about the way we do Appreciative Inquiry. So we would typically pair up people. So someone from a mental health service with someone from an addiction service, or a chief exec with someone who's kind of at a much lower place in hierarchy. Because what we're trying to do across the system is build relationships of empathy and trust. If I spend a day with you witnessing the same things that you witness, it builds empathy and trust between us. And also the sense making. So when we gather the stories, we literally sit in a circle. We write the stories in the first person because that kind of builds empathy, and we read them aloud in the group and notice what people say. So it's a kind of analogue to the formal thematic analysis you might do in a formal qualitative process. The reason, so we do use formal qualitative stuff as well, but for most workers in most services, they don't have the time to transcribe 40 pages of ums and ahs. It's a good enough process. It's not letting perfect be the enemy of good. And I would say the information that Appreciative Inquiry produces sits kind of halfway between a proper qualitative study and just a normal kind of conversation. It's truthful without kind of being truth. So, typically if I interview you and I'm writing what you say, at the end of it I say, Charlie, I think you said this, and I read back what you said, and then there's a kind of to and fro between you and me where you correct or reinterpret or clarify. And at the end of it, you are happy that I've kind of given an accurate enough representation of what you said. It's a bit like if you're meeting two friends in the pub on a Friday and you're half an hour late. When you turn up, you say, what have you been talking about? They'll give you a pretty fair reflection of what they've been talking about without necessarily, being 100% accurate.
But even with a fully transcribed piece of work, there is always that epistemological gap between what's actually happened and what we can tell from the research.
The other thing is we do it in rounds. So you do the first round of questions would be really open to give people the maximum opportunity to say what's important to them. Then you do the sense making, and from the sense making you'll have other questions. So the point is the stories are leading your inquiry rather than my preconceptions leading my inquiry. And kind of 3 or 4 rounds in, you probably will get around to asking, how can we improve the service? It's just not the starting point.
And you mentioned pairing people up. So if you're doing Appreciative Inquiry, say with service users or with citizens, you would have 2 people do the inquiry. So can you explain a bit about that?
So what when we started to do this, what we noticed is because of course you can record it on your phone, or you can do it on a Teams meeting, more people will refuse to talk to you if you're formally recording stuff. When we were doing the stuff in the parks, I was with a former colleague, Claire Turbot, who is now in Plymouth, and we were stood in the park at about 7:30 in the morning till about 7:30 at night, just saying, my name's Gary, I'm from the council, I'm collecting people's stories in the park today, would you mind sharing your story at the park with me? And they're much more happy to do that. And while I'm talking to you, Claire is writing what you're saying, and then we clarify it with you, we agree it's an accurate representation, and the next person Claire interviews and I do the writing. So it's kind of to share the like it's quite. It takes a bit of practice to do the writing down. But if you're writing it down, you get far fewer people refuse to talk to you. If you sit your mindful make notes, and you'll get to check them and that kind of thing. So that's one.
Could you give some sort of examples of where you've used Appreciative? Well, you mentioned a couple of ones. You mentioned briefly the smoking cessation and child health and weight. I know you've done a lot of work with the Plymouth Alliance around Appreciative Inquiry and around the past. I'm just wondering, it'd be interesting to know how you've used it, who you've used it with, and what sort of impact it's had.
Yeah, so the parks work was largely, so it's not service-based at all. It was how people use the sea and the parks in the country and why they don't. And so finding that, didn't find many men that look like me in parks. So you then try and find people that look like me so you can ask them why they don't use parks. I've used it with, so there was a manager staff group in the council where they had quite a poor relationship, poor staff survey. I used it with them to help resolve that. And when we did, long-term sickness went down, wellbeing survey increased. So the way I would use it in a kind of HR context is that thing about getting people to recognise how much they have in common rather than the small things that divide them. And then I would, for the managers, I kind of do two sets of three things. The first thing is that I would say, well, this issue is just a business as usual issue that you didn't need me to come and tell you that you should have done this thing as a manager and you didn't. So just fix that. And the second thing is, this is entirely within the remit of your system. You don't need to speak to any other systems to resolve this. You just need to speak to other people in your system to sort this thing. And then the third thing is, this is a boundary artifact. This has come up because two systems are meeting, neither is talking to the other. And if you talk to each other and slightly amended both your system work patterns, this thing wouldn't pop up on the boundary and you can solve it. And the other thing is highlighting to managers where their staff do not have mastery, autonomy and purpose. So mastery, autonomy and purpose are necessary for people to have a happy and fulfilled work life. Mastery is the ability to be good at a thing. Autonomy is to have some control over how you work. And purpose is the sense that you're making a difference. And we literally, list things. This is where they lack mastery, autonomy and purpose, and this is how you give it to them. And we find when managers do that, then everything gets better. I'm not saying they all, it's not like Little House on the Prairie, but yeah, things improve.
Excellent.
Other kind of examples, very, very small things. So the original ecotherapy pilot, it was just about neurodivergent children on a CAMS waiting list, very small group.
Just mention CAMS for the people.
The Child and Adolescent Mental Health Services. They have really long waiting lists. We did a project, or we didn't do a project. A project was put together by the natural infrastructure staff on our city farm and some CAMS staff to help children and their families who were on this interminably long waiting list. And our colleague Sophie has just written and will publish a paper on this. But also with the Alliance, we did hundreds of Appreciative Inquiry on all sorts of issues, and also encouraged everybody else to do Appreciative Inquiry. So, I haven't seen all the Appreciative Inquiries because part of the point is for it to become a core practice in a new kind of system culture.
And not just at Plymouth, but also you've been teaching Appreciative Inquiry in different parts of the country, and it's not just something for local authorities, is it?
No.
I need to talk about it as but you've
I've used it in Bangkok in the dockyard. Taught their HR people to do it, and they used this before COVID. I've taught people who work for the UN. I've taught people who work in other governments, in the devolved administrations in the UK, but also in other countries around the world. Yeah, I mean, you can teach it to anybody. That's the beauty of it. It's easy to teach, it's easy to do, and it changes people in a way that's very hard to kind of. It's one of those things that if I can persuade you to do it, I know you will be changed by it. Everybody is. Sometimes it can be an incredibly emotional experience, but it's always a really thought-provoking experience for everybody.
So what sort of, I suppose it's kind of like a final question, but from me, I know you've got some questions for me as well, but a final question from me is sort of anyone watching this, whether they're a local authority staff member or they're a community activist or they're an academic researcher, and we're interested in getting more involved in the Appreciative Inquiry, what do you think they should do? What have you got any tips or next steps for them?
I mean, there's a website. You can go. If you just Google,
we'll
put it on the description. Yeah. Or if you go on the Human Learning System, so humanlearning.systems website, you'll find lots of case studies where people have used Appreciative Inquiry. If it's near you, then why not give that person get in touch with that person, see if they can teach it to you. There are videos about, or you could approach us if you're kind of close to us. We can teach you that kind of thing.
Cool. Excellent. Just get started, I suppose.
Well, that's a really important thing in systems change, because obviously what drives human learning systems and what confounds new public management is that new public management assumes linearity. A causes B, and it values things like standardization and scale. But actually, what complexity theory tells us is that human systems are complex, adaptive systems, and they are non-linear. And this is why people have to gain data in new public management, because systems are non-linear.
They're trying to fit a non-linear reality to
But what that means for people like us that are interested in fostering change in systems is it doesn't matter where you start. So some of our biggest projects started, I mean, the compassionate approach to children's health and weight started with 9 stories. The stories of 9 families, and it's become this enormous thing. So you don't always have to start at the biggest, top-down, start with the chief exec's thing. So the way I think about systems is they're like a still pond, and I need to chuck a stone in the pond to make ripples, because the ripples tell me how things connect and move in the system. It doesn't matter where I throw the stone, as long as I'm making ripples, and the ripples are distant. So you can start really small, and don't agonize about it. Just crack on, do some appreciative inquiries.
Good advice, yeah. And before we go, do you have some questions?
I do. So you've recently led a paper on the way we use appreciative inquiry, and I wondered if you could speak a little bit about that research.
Yeah, so I've led on a paper with Gary and other colleagues, both at University of Plymouth and Plymouth City Council, on appreciative inquiry, and particularly the form of appreciative inquiry that Gary has pioneered, appreciative inquiry within E, and how it's distinguished from appreciative inquiry within I. And so we looked at a lot of the research that was previously been undertaken. So we did a big literature review of how appreciative inquiry is within I has been sort of implemented across public services, and what the different definitions are and the different criticisms of appreciative inquiry are. And then we looked at the Plymouth approach and different case studies, for example, child health and weight and smoking cessation, and looked at how these differed, and why this particular form of appreciative inquiry could actually be beneficial for local authorities and other organisations.
And was there anything that surprised or interested or excited you about that?
And I think when it came to looking at the literature, it was quite interesting how there were a lot of critiques of appreciative inquiry around it being too sort of positive, but also other sort of attempts by researchers to try to actually take on board some of these criticisms and combine sort of aspects of appreciative inquiry with other approaches like critical theory. And then practically from Plymouth's perspective, one of the interesting things was how, when we tend to think about appreciative inquiry, you tend to think about the actual data collection itself and the approach that's taken. There's a lot of emphasis in the literature on the 4Ds, which Plymouth has sometimes used, but it's not an essential part of appreciative inquiry within it. But I think it's also a big focus around what happens to the information after that. So the sense making and how the approach is particularly novel when it comes to that, and also when it comes to the different involvement of different types of people who are involved in appreciative inquiry. So a lot of the appreciative inquiry that's been with an I that's been undertaken tends to involve employees in organisations. Some involves service users, but in general, it tends to involve employees. In Plymouth, there's that involvement of lots of different types of stakeholders and communities. So yes, some of it is with employees, but a lot of it is with service users and citizens. And similarly, there's the involvement of different people in different sort of roles and grades in appreciative inquiry. And I think that sort of stuff was particularly important, I think, to why the Plymouth approach has been successful in a lot of areas.
Okay. So do you want to tell people where your research, how they can your research?
Yeah, so at the time of us filming this, it's not actually been completely published yet, so it's been accepted, but we're expecting it to be in the July edition of Teaching Public Administration Journal, that'll be available online very shortly.
Open access?
Open access, yes. Brilliant. Well, thank you very much, Gary. It's been really good to talk to you about this. I should just say before we go, so thank you for watching us. We'll have details of our website and further information at the end of this video. But I also just want to say, so this has been delivered as part of Plymouth Health Determinants Research Collaboration, which is a research collaboration led by Plymouth City Council, but also involving the University of Plymouth and Plymouth Octopus Project, and we are funded by the National Institute for Health and Care Research. Do check out our website for other videos or PowerPoint presentations about different research methods and approaches that we take. Thank you for watching.
Thank you.